Welcome to AETCM, the emergency medicine channel. So we know we already started the skill drill portion of Nancy Caroline. So we posted some videos like Riles tube insertion, and then we posted something like urethral catheterization. Thanks for very much response. You've given a lot of responses, and then you updated something for us. Like many of things I missed, and then you update those other things also. So this is the way we have to build up our community. So and then I wish to continue those skill drills in upcoming some of the days. So mainly in this area, I want to focus today on physical examination. So in this video, it is a nutshell regarding the physical examination. In upcoming scene, we'll see regarding the rapid full body scan and then system-wise assessment. So as like I told in this presentation, mainly we are focusing on the, so how the reality. So in scene, as a paramedic in a scene, what are the things we have to remember? So what are the way we have to assess the patient? So mainly, before getting into the topic, what is mean by physical examination? So it is nothing but physical examination in the sense we are going to use our sense to detect the person's abnormality. Means again I am telling, so we are going to use our physical sense. So sense in the sense we have a physical sense of hearing, and then we have a physical sense of sight, eyesight, and then smell, taste, and then touch. So those are the five senses we have, right? So we are going to use these five senses absolutely. More specifically, we are not going to taste anything, but we are remaining four senses we are going to use. By that, we are going to identify the abnormality in the person. So this is the way we are going to use the physical examination. So main thing in a physical examination, we have a 5 techniques. So in a format, generally we have a 4 things. One thing either you can add in this part. So first technique, that is inspection. Inspection in the sense that is nothing but, so we told, right, we have a sense of sight. So we are going to see the person without touching, so just to find out the abnormality. So if you remember our this one, emergency medicine assessment. So initially we have something, right, initial 10-second assessment. So that is what here inspection. Second thing, we are going to use the sense of our hearing. So in this 2 techniques are there. So we are going to just tap over the person's body. So that way it will produce some sound. So thereby we will identify some abnormal sound, some normal sound. That is the technique called percussion. And then palpation, we are going to touch the person's body. Thereby we will find out the abnormality. That is the technique called palpation. And then finally we are going to again use the sense of hearing. Thereby with the help of stethoscope, thereby we will identify some abnormal and the normal sound. That is the technique called auscultation. Fifth technique is olfaction. Usually in inspection category under we will under the inspection category, olfaction is one of the subcategory, but if you want to additionally mention means olfaction is one of the category. So olfaction is nothing but we will use our sense of smell, thereby we will identify some abnormal smells. So mainly if you go into the DKA cases, there you will get a fruity odor smell. So those are some examples. So this is the way we are segregating. So technique wise, inspection, we are using the sight. Palpation, so we are going to touch the person body. Percussion, we are going to tap the person body. And then auscultation, we are going to use the steth. With that we are going to auscultate. Finally we are going to use the sense of smell, that is olfaction. So here in this area we are going to demonstrate each and everything. So again one more thing I want to mention, this is only for EMT paramedics. So this is mainly we are going to focus on the pre-hospital. So this is not going to be an in-depth assessment. So in-depth assessment, already we have a lot of videos in our YouTube channel, so we can go through it. Still if you want a clarification, you can post in the comment section. So we will try to do that one. Now we'll move on to the first assessment technique, that is inspection. So inspection, I told, it is nothing but we are going to visualize, we are going to see the person, thereby we are going to identify the abnormalities, right? So again, we are not going to touch the person. By seeing itself, we are going to find out the abnormalities. So here I have 2 scenarios, different set of scenarios. You just observe each case, what are the abnormalities you are finding. So see here, in this scenario, we have a patient with an unresponsive state. So while coming itself, I am understanding the person is unresponsive state. Remaining, you have to find the person have a abnormal breathing movement. So that is why first initial impressions. So remaining things, being an EMT paramedic, always you should not exclude the scene. So you have to assess the scene also thoroughly. Not alone the focus on the patient, you have to spread your eyes, and then you have to see the clues from the scene. So here you can see some syringes, empty syringes. So thereby you can get some clues, like some might be a drug overdose or drug abuse. So those are the things. So that's why you should not exclude the scene also. So from scene we will get a lot of clues. So this is what the first scenario. Then moving on to the second scenario. So in this scenario, we have a person with a tripod position. So you can see the position of the person is a tripod. So you can see the sternocleidomastoid muscle movement. So he is using the accessory muscle of respiration. You can see the mouth. So that is a pursed lip breathing. So these are the signs will explain us the person in a respiratory distress. So this is what, without touching the person, I just enter the scene and then I assess the person. Thereby I understood some abnormalities. So again I am stressing here. So assessment, inspection in the sense, not alone the seeing the patient, you have to see the scene also. So you have to visualize or you have to overlook the scene also. Thereby you will get some clues. So yes, moving on to the second technique, that is palpation. So palpation in the sense what? So nothing but I am going to use the sense of touch. So I am going to gently palpate, touch the person's body. Thereby I am going to understand or I am going to detect the deformities or abnormalities in the person's body. So remember, in a scene we won't get that much of breathing time. Like so in hospital scenarios we will do the deep palpation techniques. Thereby we will understand or there will we will identify the some organ enlargements. So that is these are the things will take a time consuming procedures, but in pre-hospital setting in scene we won't get that much of lapsing time, so we can't do all the things in the pre-hospital. Mainly we are going to focus on the 5 things. Okay, 5 things in the sense, what are the 5 things? First one, I have to palpate the pulse. So that is the first. Second thing, I have to palpate the tenderness. So if any tenderness is there or not, mainly tenderness over the chest, abdomen and then pelvic region. So these are the major 3 areas we are going to focus. If you have a time more means, or while transport you can check the extremities also. So first one pulse, second one tenderness, third one deformity. So if any bone musculoskeletal deformity, any fractures related things you can assess, palpate. Fourth one, any crepitation. So crepitation is nothing but it is a grinding sound. So that's thing we are going to assess. And then fifth thing is a temperature. So temperature, so we just going to touch the person's body. Thereby we will understand whether hyperthermia or hypothermia. So mainly hyperthermia we can assess. So 5 things. First one pulse, second thing tenderness, third thing deformity, fourth one is a grinding sound, fifth one is a temperature. So these are the 5 things only we are going to mainly going to focus on the pre-hospital regions. So in this 5 things I am going to do in a 3 different ways. Okay, so how what are the 3 different ways means? So first I am going to use only finger pads, only fingers I am going to use. In for some other things I am going to use the ulnar aspect of the hand. Okay, ulnar aspect of the hand. You know, one more thing I am going to use for some other assessment, I am going to use only dorsal aspect of the hand. Okay, first finger pads, second thing ulnar aspect of the palm hand or hand. In the third way is a dorsal aspect of the hand. So these are the 5 techniques and the 3 ways to assess. So we'll see one by one what are the techniques we told priorly. We will see one by one. First technique is a pulse. So pulse wise you have to start with an from starting to the end. So you have to start from the temporal pulse, carotid pulse. You have to, so here carotid pulse you are going to palpate, and then you are going to the one by each pulse you have to palpate. So all the visible pulses you have to palpate and then see. So in this pulse I am going to use the finger pads. So I am going to just palpate the carotid groove, and then thereby I am going to palpate the carotid pulse. So in pulse wise you have to assess the quality of the pulse, rhythm of the pulse, regularity of the pulse, everything you have to take care. And then second thing, moving on to the second thing, that is the tenderness. So you just with the permission of the person, you just open the person's body. Tenderness wise again 3 major areas we are going to focus. First one is a chest, second one is abdomen, third one is a pelvic girdle, pelvic region. So first in a chest region, tenderness, you have a different structures, right? First you have a structure of bone related musculoskeletal we have. In abdomen majorly it is compressed with the organs. So first in a chest cavity I am going to palpate gently all the from the clavicle. I have to palpate the all other every bones I have to palpate. So first I am palpating the clavicle. So I have to ask any tenderness is there or not, and then thereby you can assess that your crepitation also. Then each rib you have to palpate and then you have to assess. So thereby you have to cross through or you have to rush through the overall chest cavity. Then you have to come to the abdomen region. So abdomen region, so before to getting into the abdomen region, how to palpate the body. So I am not going to talk about the deep palpation. Before that I am going to talk about the overall superficial palpation. Okay, light palpation. So before doing a palpation, your fingers should be adducted. So like this you have to your fingers should be adducted, and then you have to place one hand over another. Everything should be in a horizontal plane. So my hand and then my wrist, everything should be in a horizontal plane. Okay, so and then I have to gently palpate like this. Okay, so each quadrant or each region, 9 region, you have to gently palpate like this, and then you have to ask the person regarding the pain. So likewise, you have to gently palpate. So again, I'm telling, we are not going to do the deep palpation to identify the organomegaly. Only we are going to assess the tenderness. So this is regarding the abdominal. So in your pelvic also the same thing. So in depth of pelvic assessment, pelvic related things, we will discuss in the next video. So this that will be little bit time consuming one. I'm not going to focus on that area. So this is what regarding the tenderness. So first we see the pulse, second we see the tenderness, third we are going to see regarding the deformities. So deformities is nothing but, again here also I am going to, from the upper body to the head to the toe, you have to quickly run through the body. So you have to just palpate the bony, musculoskeletal related any deformities is there or not. Just within your finger pads, you have to just quickly rush through the body. So that is the third one. Fourth one also, simultaneously you can do the crepitations also, right? And then fifth one, temperature. If you own a glove means you just turn off the glove and then you just place your dorsal aspect of the hand. So thereby you can identify the temperature related thing. So remember 5 things in a 3 different ways. First thing, pulse, I'm going to use only finger pads. And then second thing, tenderness. So I told how to place your hand. So it should be adducted, finger should be adducted, and then one over another hand, and then you have to gently, everything should be in a horizontal. So your hand and then palm should be in a horizontal manner. Gently you have to palpate each quadrant. If it is a chest means you have to palpate each bone, thereby you can identify the tenderness. And then third part, we came into the deformity related things. So again, you have to, from the musculoskeletal, any deformities there or not, that way you have, with the finger pads you can just assess the bone arrangements. Then we came into the crepitation part. So along with your deformity, you can assess the crepitation also. Finally, we came into the temperature. For temperature, we are using the dorsal aspect of the hand. You just place in the person's neck or forehead. So thereby you can understand the temperature. So these are the 5 important things you have to remember in the palpation part. So our third technique is percussion. So percussion is nothing but, here also I am going to use the sense of touch and then I am going to use the sense of hearing. Both sense here we are going to use. Okay. So the same thing, what is meant by percussion? Percussion in the sense, this is nothing but I am going to gently strike over the person's body or surface of the body. It will create or it will produce some sound. So with that I am going to describe the abnormalities. So these are the things regarding the percussion or definition regarding the percussion. And then second step, how to do the percussion. So that is the most important thing. So I'll just remove with the help, with the permission of the person, consent of the person, I'm removing this one and then I'm removing the shirt also. So percussion, so mainly we'll do in the chest and then abdomen. So I will perform you first abdomen. So here, see my fingers here. So 5 fingers are there. In that one finger, that middle finger should be hyper extended. So here you can see one finger, that middle finger alone I hyper extended. That thing only contacted with your surface of the body. Remaining things, so remaining 4 fingers I kept stay away from the surface of the body. Okay. So you just gently press and then with the other hand you just gently strike over the person's body like this. Okay. See, close movement. I am going to strike only with the help of my wrist. I'm not going to strike like this. So I'm using my wrist alone and then gently you have to strike over the person's surface. So first, again I'm explaining. So first you have to hyper extend your middle finger and then that finger only should be contact with your surface of the body, and then you have to use the another hand finger and then you have to gently strike over the person's body. So like this you have to perform the percussions. So coming into the what are the areas or what are the common sounds it will produce means, first thing, if you are percussing over the lung region, so lung where you have to do, so you have to supraclavicular region if you are percussing, or between your intercostal space, there you are percussing means it will produce some resonant sound. So if it is resonant sound means how it will be means, it will be a loud sound and then low pitched sound. So I'll show you the audio clip over there. So it will be like a loud and then low pitched sound. So you have to palpate, so the same area, intercostal space area you have to keep and then you have to gently strike over the person's lung. So this is called the resonant sound. So moving on to the next, that is a hyper resonant sound. Hyper resonant sound, how it will be means, it will be a high loud sound. So the sound will be like where it will produce means, if your lung have too much of air, so the condition like emphysema, there it will produce the hyper resonant sound. Okay, so resonant and then hyper resonant. How you can by yourself, how you can do means, you just tap over your cheek. So like this, you just tap over your cheek, there you will get some sound, that is a resonant sound. In hyper resonant, you just pop out with air, puffed out, you just puff out your cheek with air. So like this. So if there you will get a one sound, that is a hyper resonant sound. Okay. So in a normal cheek you will get a resonant. In a puffed out cheek you will get a hyper resonant sound. So that is regarding the chest. Then abdomen part we will get a one sound, that is called the tympani. Tympani is nothing but it is a drum like a sound. So if your abdomen filled with the gas, there if you are palpating, there if you are striking means there you will get a tympani sound. So it will be a very loud sound. Mainly it will occur in the gas collection in the either viscous organ, like in your bowel. If it is a gas collector, means there it will be like a tympani sound. On to the next sound, that will be a dull sound. So dull sound mainly we will get in the mass. If any mass is there or any pleural effusion is there, means there if you are doing your things striking, means there you will get a dull sound. So if you are striking over your bones or muscles, means there you will get a flat sound. So there will be a low single pitch sound, flat sound you will get. So common sounds we will get in the case of percussion. So first thing we told what is mean by percussion, second thing how to do we explain, third thing common sounds. So resonant, hyper resonant, tympani, third one is a flat and then dull sounds. So this is the things regarding the percussion related things. Okay, so now moving on to the fourth technique, that is auscultation. So auscultation in the sense what? So here we are going to use the sense of hearing, right? So with the sense of hearing, we are going to auscultate some sounds. So which is normally it will that body will produce some sound. That is the sound we are going to use to auscultate. Mainly in a pre-hospital, what the area we are going to focus means heart sounds and then breath sounds, bowel sounds, and then you can include your manual BP. So corrector cuff sound also you can include. So these are the four sounds mainly we are going to focus on the or pre-hospital scenarios. So in hospital also, so in hospital still more elaborately they will do for carotid, brew, and then some more the sounds they will go, but mainly in a pre-hospital, so some set of basic things we are going to focus. So first thing, before getting into the auscultation, you have to make sure the crew, your ambulance crew, is quiet enough to auscultate, because if you have a additional environmental sound, means we can't auscultate because it will produce lot of noises again. But I know it is very difficult, a lot of scenarios I also faced, but it's difficult to auscultate because we won't get a quiet environment. So once if you enter into the crew, means there will be a silent sound and then there will be environmental sound, lot of things are there, but it's better to auscultate in a scene itself. Again you can ask me, we can't spend more time in the scene also. So anyway, so those are the challenges we have, so we have to overcome those other things. Okay, so now getting into the auscultation. So first I told cardiac sound auscultation, right? So commonly we have two common sounds basic wise, so that is lub and then dub, S1 and then S2. So S1 when it will produce, so it is a closure of atrioventricular valve. So atrioventricular valve in the sense tricuspid that present between the right atrium and then right ventricle, mitral valve that is present between the left atrium and then left ventricles. So when at the time of closure of both atrioventricular valve closure, we will get the sound of lub. Okay, then dub wise it will produce when the time of semilunar valve closure. Semilunar valve in the sense that present the aortic and then pulmonic valve. Okay, so those are the things, if they close remains, that will produce the sound of dub. Actually dub is a somewhat high intensity sound compared to your lub. Okay, so these are some basic ideas regarding the lub and that dub, and then S1 and then S2. So S3 S4 also is there, and then when it will produce, what are the abnormal sounds that will comes in the cardiac murmurs and all, already we discussed in the cardiac assessment PPT presentation itself. So here I am going to demonstrate how to auscultate the S1 and S2. If you want a further information, you just check it out those PPT presentation. Okay, so S1 first we'll do the S1 sound. No, we'll go with a dub first. Okay, so where you have to palpate the dub. So dub, when we told, it will the closure of semilunar valve. Okay, so first, so you just palpate the sternal notch first. Okay, so this is the sternal notch. Here in above the sternum you have a one pit like a thing, that is the sternal notch. So sternal notch, just palpate below, then one point you will get a harder portion of the bone. Okay, it's like what I can tell, it's like a one elevation like a thing, or harder portion of the bone. So that it is a point of sternal angle or angle of Lewis. So correspond to that sternal angle, you will get a one rib, that is the second rib. Okay, so both side you will get a one rib, that is the second rib. So in that below the second rib, that is a space of second intercostal space. Okay, so between the second rib and then here I have a third rib, between the second and third rib we have a second intercostal space. So this is right side, this is left side, am I right? So this is right side, this is left side. So if you auscultate the right side, second intercostal space, that is your aortic valve, and then just opposite to that left side, if you auscultate, means that is a pulmonic valve. Okay, so how I palpated, first I palpated the sternal angle, and then from the sternal angle I palpated slowly. At the one point I feel some harder portion of the bone, or it's like I can't tell like it's a mountain shape, but the flat cone, it will get a small bulge. So that is the area of called the sternal angle or angle of Lewis. So correspond to that, you will get a one rib, that is a second rib. So below the second rib, we have a space that is called the second intercostal space. So right side of the second intercostal space, you will get a aortic valve, and then your second intercostal space, left side, you will get a pulmonic valve. Okay. Then, so this is the S2. Then coming to the lower, next I can palpate the third rib and then third intercostal space, then next to the fourth rib followed by fourth intercostal space. So in fourth intercostal space, so this is the sternum. So along the side of sternum, fourth intercostal space, you can palpate the your this side tricuspid valve. Okay, so tricuspid valve thing, and then followed by fifth rib, fifth intercostal space, mid clavicular line. You can palpate the you can auscultate the your this side mitral valve sound. Okay, so actually you can ask me why the tricuspid came here, means actually heart placed is obliquely, it placed in a oblique manner. So aortic, so if it is placed like this, means here in this area you will get aortic. That's why we second intercostal space, right side we auscultated. So and then left side here we auscultated the your pulmonic valve. So because of this oblique position, so all the right portion will come to the left side. So it is deviated to the left side. That is why in fourth intercostal space, along the side of sternum, we auscultate the your tricuspid valve, and then so it is placed towards the left, right. So that is why your fifth intercostal space, mid clavicular line, we auscultate the your mitral valve. So in an easier way, in a fifth intercostal space, how you can remember it, just auscultate near the nipple. So lateral to the nipple and near the nipple, there you will get the your mitral valve sound. So this is the thing regarding the cardiac sound auscultation. Hope it is clear. So don't confuse anything. Just to palpate the sternal arch, go for the sternal angle, corresponding rib, that is a second rib, followed by second intercostal space, right and then left. Right is aortic, left is your pulmonic. Then followed by just to palpate third rib, third intercostal space, fourth rib, fourth intercostal space. Along the side of sternum, left side you will auscultate your tricuspid, and then fifth intercostal space, that's nearby nipple, mid clavicular line, you will get the mitral sound. So clear. So one more sound is there, that is third intercostal space, Erb's point. Most commonly you can exclude in the pre-hospital scenario, so we can't do all the things, we won't get a time. So this is regarding the your heart sound auscultation. Moving on to the next side, that is the breath sound auscultation. So here also we have a various sites, like 9 regions commonly they used to auscultate. That is, the area is an first, this is the clavicle, right? Supraclavicular, infraclavicular. Okay, so before so I'll tell supraclavicular, infraclavicular, and then you can go with an mammary region and then inframammary. Then posterior side, if you want to auscultate, means, so whatever things you are recording in the posterior side auscultating, that is the base of the lung. Okay, so the base of the lung, this is the scapula. So suprascapular, infrascapular, and then here you will get a interscapular region. So these are the 9 various region. One more thing in a lateral part, so this is the axilla, and then supraaxillary, infraaxillary. So these are the common thing we will auscultate in the your vesicular related things. So before that I missed one thing. So in a breath sounds, commonly we used to auscultate 2 regions. Okay, region in the sense, first one bronchial breath sounds and then vesicular breath sounds. So actually I want to start from there only. So anyway, so first bronchial breath sounds and then vesicular breath sounds. So in vesicular only we are auscultating this 9 region. Bronchial is nothing but, so whatever you are auscultating over the trachea, that is the bronchial breath sounds. So you just keep your just keep your state, make sure it is on. So just state over the trachea. So whatever breath sound you are hearing over the trachea, that is the bronchial breath sounds. Okay, and then whatever breath sound you are hearing over the lung field, that is the vesicular breath sounds. So how the nature will be, means bronchial breath sounds, it will be in a high intensity or it will be a high loud pitch sound. So but vesicular breath sound will be a low pitch sound compared to your bronchial breath sound, it will be a low pitch tone wise. Then bronchial breath sound, if you auscultate, means both inspiration and then expiration will be in the same intensity, same time interval mostly, and then it will have a gap between the inspiration and then expiration. So if you auscultate, means there will be inspiration and then there will be a gap and then expiration will be there. Okay, but in vesicular you will get no gap between the inspiration and the expiration. So there will be a continuous thing, inspiration will be there and then expiration will be there. So these are the difference between the bronchial and then vesicular. So areas of auscultation, as like already I told, so bronchial in the sense nothing but you just to keep your step over the your tracheal area, thereby you will get a one breath sound. So that is a bronchial breath sound. And then in a second intercostal space or at the level of angle of Lewis, the trachea will divide into right and then left main stem bronchi, and then from that it will begins the bronchiovesicular sound you can hear. If you want to auscultate bronchiovesicular sound, you can keep your steth in that second intercostal space, and then you can go with a vesicular breath sound. So again I'm repeating that 9 region. So this is the clavicle, supraclavicular, infraclavicular, then mammary region, inframammary region. Okay, so then lateral side supraoxillary and then infraoxillary, then posterior side it is this is the scapular bone. So here interscapular region, between the two scapula, interscapular region, and then here you can auscultate the suprascapular, that is we call as a apex part of the lung, and then infrascapular also you can auscultate. So these are the things regarding the breath sounds. So whenever you are auscultating the breath sounds, you have to compare simultaneously both sides. So if you are auscultating clavicular means, so left side and then right side also you have to auscultate. Then infraclavicular means this side and then both sides. So simultaneously, first you have to assert here 1 and then 2, and then again 1 and then 2, 1 and then 2, 1 and then 2. But the thing is, in a pre-hospital, again we won't get that much time to auscultate all the 9 regions. Better what the best we can do means, just to go with an, if you placed endotracheal tube quickly you want to assess means, better the area is an infrascapular mid-axillary line. So the mid-axillary line you can place your steth, the both side you can auscultate the breath sound. Then one more thing you can do, the all infra regions like inframammary you can do, infraaxillary you can do, infrascapular you can do. So these are the 3 major sites easily you can auscultate in a pre-hospital. So if you don't have much time, or if you want to verify the endotracheal tube means, quickly you just place your steth, diaphragm of the steth over the your infraaxillary line, mid-axillary. So it should be in a this axilla, infraaxillary region, exactly in a mid point of the axillary line. Okay, then both side you have to auscultate, and then you can auscultate the inframammary and then infrascapular region. So these are the things regarding the breath sounds. Okay, then moving on to the next sound, that is a bowel sound. It is very easy. You just place your steth in the right lower quadrant. Okay, just to palpate right lower quadrant, and then in the umbilical line, again if you want to go that side means, you just palpate in the umbilical line, you just move upward, just upward, and then there you can auscultate the one more sound, and then comparatively you can go with the left lower quadrant also. But ideally we will auscultate the right lower quadrant. So this is the thing regarding the breath sound. So Korotokov sound, that also you know we have to wrap the blood pressure. So you will get the different levels. So first it will produce, so one sound it will start, that is systolic blood pressure, and then auscultatory gap will be there, and then second sound, third sound, fourth sound. Finally the fifth sound will come, and then the sound will end up there where the sound is ending, that we will mark as a diastolic blood pressure. So that is regarding the blood pressure related. So hope it is easy one, it is not that much complicated. But the thing in auscultation, we have to regularly practice this one. So now we told only normal sounds. Already, as like I told, abnormal sounds, both respiratory and then cardiac, we given a assessment, cardiac related assessment for paramedic. Already we did a presentation. If you not go through that one means, you just go through, you will get a various breath sounds also we explained, wheezing how it will be, and then we given a sound, how the sound will be. So every sound clip also already we added in the presentation. So this is regarding the auscultation. Then one more thing, auscultation and then palpation, this is quite bit difficult. Again, we have to regularly practice those other things. So these are the whole things regarding the physical assessment. So initially we started with the inspection, and then we came into the palpation, percussion, and then auscultation. Finally, one more technique, that is olfaction. Usually we won't perform as a separate one. So some of the things, some of the people, they will do as a separate, or you can include under the inspection part itself. Okay. So olfaction is nothing but we are going to use the sense of smell. So we will smell. So some in the case of we given if the person of alcohol intoxication, so you can mark it down in your document paper. There is an evidence of alcohol intoxication. Then you can, if any diabetic ketoacidosis, there you will get a a ketone bodies, fruity odor smell. So if the person have a CKD related thing, a longer time he CKD, and then is not in a follow up of any treatment, so there is a illiterated care means, there you will get some uremic smell. So those are the things will comes under the olfaction. Okay. So these are the 5 things regarding the physical assessment techniques. So following video will move on to the rapid full body scan. So those are the things we'll see in the upcoming videos. So do your best. Shalom.